Hey, I'm Dr. Chris Kelly. I'm the chair of cardiology at UNC Rex Hospital, and February is Heart Month. So today we're going to go over 3 signs that you could be having a heart attack. The first sign of a possible heart attack is the most classic sign of them all, and that's chest pain. Sometimes it's described as chest pressure, tightness, or fullness, or just aching. If you're having anything in your chest that feels uncomfortable and it's not getting better after a few minutes, especially if it's also going into your shoulders, arms, or jaw, that's a really concerning sign and you need to get to an emergency room right away. The second concerning sign is sudden onset shortness of breath. If you're not really doing anything but you feel like you've just run a mile, it could be a sign that your heart is struggling to function properly and fluid is backing up into your lungs. So if you get sudden onset shortness of breath, get straight to an emergency room for further evaluation. The third sign of a possible heart attack is actually abdominal pain and nausea. Now, a lot of things can cause that, but if you have risk factors for heart disease and you're over the age of 50 and you have sudden onset.
5 best foods to prevent a heart attack. The old way of measuring whether or not you were going to have a heart attack began with a 1950s test where we looked for the LDL, or bad cholesterol. This is a terrible way to tell if you're going to die from a heart attack. I would rather see your omega-3 index. A study done of patients on their way to a hospital in the ambulance, looking for who was going to live and who was going to die. A low index predicted death, and those with the highest omega-3 index were 90% less likely to die. I'll take those odds. What are the 5 foods highest in omega-3? Smash this. Sardines, mackerel, anchovies, salmon, and herring.
An intense chest pressure or squeezing sensation, sometimes radiating to the arms, neck, or jaw, accompanied by shortness of breath, nausea, or cold sweats. At times, it can be life-threatening. This is called a heart attack. A heart attack can strike out of nowhere, and when you're alone, every second is critical. What you do, or don't do, could be the difference between survival and tragedy. Would you know how to react if it happened to you right now? Most people freeze or make mistakes that cost precious time. Don't let that be your story. In this video, I'll walk you through 10 important steps to take immediately if you're ever faced with this situation. These tips are intended for informational purposes and can provide general guidance. Always seek professional medical help when needed. Number 1. Recognizing the early warning signs.
We need to be aware of a possible heart attack to help save lives for our family, our loved ones, and friends. The first most common symptom is crushing pain, tightness in the chest, and the second category is lightheadedness, dizziness, or any other kind of pain. The person may have nausea, vomiting, perspiring. They may have pain radiating to the neck, the jaw, the throat, the abdomen, or even the back. You could have pain going down the arm. Those nerve fibers run along with those cardiac nerves, so the brain gets confused. And the third thing is changes in your ability to exercise, lower exercise tolerance. If you're walking upstairs or doing something that shouldn't be strenuous and you're having a hard time breathing, you have to stop. And 4, being short of breath or having labored breathing, especially while at rest. And the 5th thing is an overall feeling of being uncharacteristically unwell or fatigued. If you just feel horrible, not feeling well, you know something's not right, you know it's not the flu, many of these conditions experience heart attacks even hours later. So I'm counting on you to help save a life. Get help immediately.
A heart attack happens when blood can't get to the heart, usually because something's blocking the way. Now, you'd think a heart attack is this dramatic moment with someone clutching their chest and falling over, right? Sometimes it is, but often it's not that obvious. The signs can be subtle. You might feel tightness or pressure in your chest, like someone sitting on you, or the pain might appear in unexpected places, like your arms, jaw, back, or even your stomach. Then there's shortness of breath, suddenly feeling like you've run a marathon without moving. Cold sweats, nausea, or dizziness can also signal that something's wrong. Here's an important fact. Nearly half of all heart attacks are silent. This means people may not realize they're having one. Symptoms might feel like mild heartburn, fatigue, or just being unwell. This happens often, especially in people with diabetes, because their nerves may not register pain in the same way. For women, symptoms like back pain, neck aches, or exhaustion can replace the classic chest pain. Heart disease remains a significant health concern. A person dies from it every 33 seconds worldwide. Silent heart attacks contribute to many of these fatalities because people don't act in time. If you notice anything unusual, don't wait. Always seek medical attention promptly. Number 2. The first 60 seconds. Why immediate action matters. When you're having a heart attack, the first 60 seconds can be critical in determining the outcome. Here's what happens inside the body. Blood flow to the heart becomes blocked. Without blood, the heart is deprived of oxygen, and heart cells can start to die within minutes. Studies suggest that survival rates decrease by approximately 10% for every minute that passes without treatment. This is why these moments are sometimes referred to as the golden window. It's the time when taking action, like calling emergency services, can make a significant difference. However, panic often interferes. The person experiencing the heart attack may panic, as can people around them. This heightened stress releases hormones that can worsen the situation by placing additional strain on the heart. Remaining calm during this time is essential. Staying calm helps you think clearly, call for help, and take steps like using aspirin or administering CPR if trained. Many people misinterpret the signs of a heart attack as something less severe, like gas or muscle pain, delaying critical action. Research indicates that seeking help within this first minute can dramatically reduce heart damage. Remember, acting quickly and calmly is your best chance to mitigate the effects of a heart attack. Number 3. Calling 911. Even if you feel uncertain.
If I want to know your risk of a heart attack, LDL cholesterol is the last thing I look at. First, I look at your average blood sugar over the last 3 months using a hemoglobin A1C. Ideally, I like it between 4.5 and 5, but my last one was 5.2. The second thing I look at is triglycerides. 12 hours into a fast, it should be less than 50, unless you're insulin resistant. Triglycerides rise when you eat too much, specifically carbohydrates or alcohol. Systolic blood pressure is next. When that top number goes higher than 120, your risk goes up. Fourth, HSCRP measures the inflammation on the inner lining of blood vessels, but LPIR wins. A high lipoprotein insulin resistance score is 4.5 times more dangerous than an LDL cholesterol score. Heart attacks happen when insulin slows down the delivery of fat. My LDL cholesterol score is considered dangerous, but my LPIR score is perfect, so I don't care.
Delaying a call to 911 can have serious consequences. Here's why calling 911 immediately is so important. Paramedics can start treatment the moment they arrive, offering oxygen, monitoring your heart, and even performing life-saving procedures on the way to the hospital. Pro tip: when you call 911, put your phone on speaker mode so you can follow instructions without straining yourself. While aspirin can be helpful, it's not a replacement for emergency care. If you suspect you're having a heart attack, the priority should always be to call 911 or seek medical attention immediately. If you or someone around you experiences symptoms of a heart attack, the best course of action is to call 911 immediately and follow professional instructions. If you haven't already called 911, do so immediately. Letting someone know your condition increases the likelihood of receiving assistance quickly. Once you've safely stopped, turn on your hazard lights to alert other drivers that you need help. Then, call 911 right away. The solution? Take symptoms seriously and act quickly. If you feel unusual chest pain, shortness of breath, or other warning signs, call 911 immediately. Number 4. Chewing aspirin, the life-saving trick. In case of a heart attack, one small step that can help slow down the damage is taking aspirin, a common medication you may already have in your home. Here's how it works. During a heart attack, a blood clot blocks the flow of oxygen to the heart. Aspirin can help by reducing the blood's ability to clot, which might prevent the blockage from growing larger. Chewing aspirin is recommended because it dissolves faster and gets into your bloodstream more quickly than swallowing it whole. Experts suggest a dose of 160 to 325 milligrams, essentially one full-strength tablet. However, this should be plain aspirin, not the coated kind, as coated aspirin takes longer to break down. Aspirin isn't a cure-all, but studies suggest that taking it during the early stages of a heart attack can reduce the risk of fatal outcomes by up to 23%. It's important to note that this step should only be taken if you are not allergic to aspirin or have been advised against it by a healthcare professional. While aspirin can be helpful, it's not a replacement for emergency care. If you suspect you're having a heart attack, the priority should always be to call 911 or seek medical attention immediately. Aspirin can buy time, but doesn't address the underlying issue that requires professional intervention. Number 5. Positioning your body to reduce heart strain. Taking aspirin isn't the only action you can take to support your heart during a heart attack. The way you position your body can also play a role in reducing strain on your heart while waiting for emergency care. Lying flat on your back might feel natural, but it can make things harder for your heart. In this position, gravity doesn't assist blood flow, and this can increase the workload on your heart. Additionally, lying flat can make breathing more difficult if your circulation is already compromised. Instead, it's recommended to sit upright. Sitting helps blood flow more efficiently, and your heart doesn't have to work as hard. This position also provides more room for your lungs to expand, making it easier to breathe. It's important to debunk a common misconception: elevating your legs to improve circulation. While this can be helpful in other situations, during a heart attack, elevating your legs can cause blood from your lower body to rush back to your heart. If your heart is already struggling, this sudden increase in blood flow can overwhelm it, worsening the situation. The next time you or someone else experiences symptoms of a heart attack, remember, sit upright and stay as calm as possible. This simple step can make it easier for your heart to function until help arrives. Number 6. The cough CPR. Myth. What really works? You might have heard about cough CPR, the idea that if you're having a heart attack, you can save yourself by coughing forcefully and repeatedly. While this concept has circulated widely, it's important to understand that it is a myth and is not supported by medical guidelines for heart attack treatment. Here's why. A heart attack occurs when blood flow to the heart is blocked. Coughing doesn't address this blockage. Instead, attempting cough CPR can waste critical time that should be spent calling for emergency help. The origin of this myth stems from a medical procedure performed in hospitals under professional supervision. In rare situations, a medical team may instruct a patient to cough during specific cardiac events, but this is done with constant monitoring and not something a person should attempt independently. If you or someone around you experiences symptoms of a heart attack, the best course of action is to call 911 immediately and follow professional instructions. Focus on remaining calm and breathing slowly to reduce additional stress on your heart. Avoid trying unverified methods like cough CPR, as they can delay the help you truly need. Remember, the key to surviving a heart attack is seeking timely and professional medical care. Number 7. Staying alert while waiting for help. What if you're alone and suddenly feel sharp pain in your chest or other symptoms of a heart attack? It's a frightening situation, but even while waiting for help, there are steps you can take to support your body. First, avoid exerting yourself. Gentle movements like tapping your feet or moving your arms may help maintain blood circulation, but only if you feel capable of doing so without strain. The priority is to remain as calm and stable as possible. If you feel dizzy or lightheaded, it's a sign your brain isn't receiving enough oxygen due to reduced blood flow. In this case, avoid lying flat, as this can make breathing more difficult. Instead, sit upright with your head elevated above your chest. This position helps facilitate better blood flow to your brain and heart. It's also critical to keep an eye on worsening symptoms. If the pain intensifies or you struggle to breathe, try to text or call someone nearby to inform them of your situation. If you haven't already called 911, do so immediately. Letting someone know your condition increases the likelihood of receiving assistance quickly. Remember, heart attack symptoms can escalate rapidly, and every minute matters. Staying as alert and calm as possible while taking appropriate actions can make a significant difference while you wait for help. Number 8. What to do if you're driving during a heart attack.
How to survive a heart attack while driving. Symptoms of a heart attack are pain or pressure in the left arm, chest, neck, and jaw. And other symptoms can be lightheadedness, nausea, or shortness of breath. So here's what to do if you go into cardiac arrest behind the wheel. Step 1, take your foot off of the accelerator and let friction stop you while you pull away from traffic. Step 2, cough. Some experts recommend coughing in a rhythmic pattern. This will help send oxygen-rich blood to your brain and body and help regulate your breathing. Step 3, once you've found an opening in the road, pull off to the side and call medical emergencies. The best way to prevent a heart attack behind the wheel is to prevent a heart attack at all, so stay in shape, don't smoke too much, and try to keep your stress levels as low as possible. About 30% of car crashes are from medical emergencies, so make sure you know.
Now imagine you're driving when you start to feel symptoms of a heart attack, chest pain, dizziness, or nausea. This is an extremely dangerous situation that requires immediate action to keep yourself and others safe. The first step is to pull over immediately. Don't try to tough it out or continue driving to your destination, as this could put you and others on the road in serious danger. Once you've safely stopped, turn on your hazard lights to alert other drivers that you need help. Then, call 911 right away. Speaking with emergency responders is crucial. They can guide you on what to do while sending assistance. If you're alone, put your phone on speaker mode so you can follow instructions without needing to hold the phone. Avoid making sudden movements or attempting to leave the vehicle, as this could worsen your symptoms. Instead, remain seated, stay calm, and focus on breathing slowly and deeply. Studies suggest that seeking medical attention within the first hour of heart attack symptoms significantly improves outcomes. If you suspect a heart attack, don't wait or try to drive yourself to the hospital. Trust the professionals to provide the help you need. Your safety and the safety of others on the road is the top priority. Acting quickly and pulling over could save your life and prevent further harm. Number 9. Preventing future heart attacks. Simple lifestyle changes.
Drinking water a certain time of the day maximizes its effectiveness on your body. 2 glasses of water after waking up helps activate your internal organs. 1 glass of water 30 minutes before a meal helps digestion. 1 glass of water before taking a bath can help lower your blood pressure, as well as 1 glass before you go to bed can help avoid stroke and heart attacks.
Surviving a heart attack is only part of the journey. Taking steps to improve your heart health can help reduce the risk of future heart attacks. Here are some simple but effective lifestyle changes to consider. First, make physical activity a regular part of your routine. Exercise strengthens your heart, improves circulation, and helps maintain a healthy weight. You don't need to do intense workouts. Walking, dancing, or light jogging for at least 30 minutes on most days can make a big difference. Studies suggest this can reduce your risk of heart problems by nearly 50%. Next, focus on your diet. Choose nutrient-dense foods like fruits, vegetables, whole grains, lean proteins, and heart-healthy fats such as those found in nuts, fish, and olive oil. Limiting your intake of processed foods, added sugars, and unhealthy fats can also protect your heart. A balanced diet provides your body with the nutrients it needs to function optimally and maintain cardiovascular health. Stress management is equally important. Chronic stress can elevate your blood pressure and release hormones that strain your heart. Practicing mindfulness, deep breathing exercises, or engaging in hobbies can help lower stress levels. Finding healthy outlets to manage stress is key to long-term heart health. Finally, don't skip regular checkups. High cholesterol and elevated blood pressure often don't have noticeable symptoms, but they are significant risk factors for heart disease. Regular visits to your healthcare provider can help identify and manage these issues early, reducing the likelihood of more serious complications later. By incorporating these habits into your daily life, you can give your heart the support it needs to stay strong and healthy for years to come. Prevention is always better than cure, so take steps now to protect your future health. Number 10. Mistake that makes a heart attack worse. Heart attacks are a leading cause of death worldwide, but there's one common mistake that makes the situation worse: ignoring the symptoms. When people experience chest pain, shortness of breath, or discomfort in their arms or jaw, they often dismiss it as stress, indigestion, or something minor. They wait, hoping the symptoms will go away. Unfortunately, this delay can be deadly. Here's why timing matters. During a heart attack, the heart muscle is deprived of oxygen due to a blocked blood supply. The longer this blockage goes untreated, the more damage occurs to the heart muscle. Research indicates that waiting more than an hour to seek treatment can increase the risk of death by as much as 50%. Men, in particular, are more likely to downplay their symptoms, thinking they need to tough it out. However, this mindset can lead to serious consequences. Heart attacks don't always present with dramatic symptoms. In fact, many occur without warning, and the first signs might be mild discomfort, fatigue, or nausea. In the United States alone, approximately 735,000 people experience a heart attack each year, and nearly half of them don't recognize they're at risk until it happens. Globally, heart disease claims over 17 million lives annually. The solution? Take symptoms seriously and act quickly. If you feel unusual chest pain, shortness of breath, or other warning signs, call 911 immediately. Don't wait to see if the symptoms improve. Seeking medical attention promptly can save your life and minimize heart damage. Ignoring symptoms isn't bravery, it's a mistake. Early treatment is critical, and the sooner you act, the better your chances of recovery. Remember, being prepared can save your life when it matters most. Recognizing the signs of a heart attack and knowing how to respond could make all the difference. Do you know someone who could benefit from this information? Share this video to help raise awareness and protect others. Sharing knowledge empowers people to act swiftly and confidently in critical moments. And don't forget to subscribe for more life-saving health tips. Your health is your most valuable asset, and we're here to provide information that can help you care for it. Thank you for watching, and we'll see you in the next video. Stay safe and take care.